Yeah, thank you very much, Stephanie. I was actually just writing down some notes because some of the studies that you did with the Black people's experiences of discrimination throughout the whole process is very key, as you so rightly mentioned, and it's part of the process of understanding how not just how Black people experience, as you rightfully said, schizophrenia or non-common mental health disorders, but also how we experience depression and anxiety. Um, so then, I guess following on from that, it would be very good actually to understand um, how we can learn from this research and tackle inequalities in healthcare through some of the research that you've just done, and also actually through the Heron Network, because Stephanie, you lead the Heron Network, which held a conference in 2018, which explored the current and future directions in health equity research and action from researchers, community organisations and healthcare representatives.
So I think one of the things that, so we have over time, over the last, so Heron started to about 10 years ago. And so we've been running Heron. I mean, I want to be really clear that I just decided it was going to be. And my team will tell you, I said, look, nobody seems to understand why it's important that we have this network that's focused on engagement. It's focused on bringing service users to the table with healthcare providers, with researchers, with, you know, community activists, so that we're not talking at people, that we're all having a conversation, and there's an element there of us trying to create the equity and how we relate to each other. So my vision was just to say, let's just make it happen. So we literally, I had my PhD student draw a bird, a heron bird, and we put it on some recyclable bags and made some cards. And that's how it started in 2010, because it was about creating something that at the time, it wasn't something you were going to get money for, but we needed an identity, and we started working in the community. So we had that conference in 2018, but we had a previous one in 2014. But the conferences are where we bring, you know, people from all across different sectors together to have conversations and to share their work. That's not so much the important part for Heron. Heron is about engaging with community organizations, engaging with the schools, and taking the research into environments and working with people in ways that, you know, you wouldn't normally consider. So public engagement isn't an add-on. It's a part of the work that we do. So when you come to work for my team, that's a part of your job. It's in the job description. That's not something I'm asking you to do in your off hours. You know, so it's a really important thing for me that it's, you know, how we work with community organizations, how we work with schools, and those types of activities that we've been using. So where I see our ability to potentially tackle inequalities is not through the research, it's through the interactions that we're having with the community and being led by the community in terms of doing work with them. So that knowledge production shouldn't just happen in academia. The most important knowledge production for me is happening closer to, you know, to the communities. It is that social justice model where we're thinking about, you know, where is this evidence? What do we, you know, we need to reevaluate what evidence is. You know, what do we think we know? Where does it come from? Who's included? What perspective is it coming from? So that's really, for me, I just wanted to sort of clarify that I'm not entirely sure in that question, that it's just about what we're producing in academia. I think that the only way academia, in my mind, that I feel comfortable at playing a part is if we're working across systems, across sectors, and working differently, and always pushing ourselves to work differently. So I've been thinking a lot about, you know, we need to work differently and we need to think differently. So in order to work differently, we've got to start thinking differently and thinking of the more, you know, a wider adoption of these types of collaborative models, because we don't own these things. You know, this is not, you know, I feel like it's, you know, it's just really something that not only goes through the work, but in, you know, also in terms of, you know, the way I teach and the way I think about, you know, equity, diversity, and inclusion, and most importantly, the practice of inclusion across those things. I hope that answers your question.
It very much does. Thank you for that. And I really liked you picking up on the fact that academia shouldn't just be doing research. We should be building a community-based framework where we're engaging and collaborating with these various organizations in the community. And I think that opens up a wider discussion about research participation and why sometimes we as academics find it difficult to recruit various individuals from different backgrounds, as well as different factors as well. And actually, I think that kind of leads into Dawn's research, because essentially we know that in research, it's often been suggested that culturally adapted psychosocial interventions for mental health can improve African Caribbean groups' access to evidence-based care and outcomes. And for example, a feasibility study conducted by Dawn on culturally adapted family intervention for African Caribbeans with schizophrenia and their families demonstrated that it is feasible amongst service users, families and healthcare professionals to culturally adapt family interventions for African Caribbean service users and their families. In trialling the culturally adaptive family intervention, the study also showed high rates of recruitment, attendance, retention, and data completion. However, what we see is that this work is generally not located within wider service change, which is likely to be necessary to sustain the work on culturally adaptive interventions and lead to genuine equality of access for minority populations. So I'll direct this question to you, Dawn. Why is it important for researchers, practitioners, and healthcare services to investigate, produce, and offer culturally adaptive interventions for common mental health disorders?
Oh, that's a big question, right? And just to, I was smiling when Stephani was talking about and just thinking about about the overlaps between, you know, the work that we do and the place that it comes from. So very definitely the work I see it's got to be grounded in the communities and in their needs and their views and opinions. And one of the most rewarding aspects of the work that we've done was organising these conferences where over a weekend in a Black majority church in Manchester, we'd have over 500 delegates who would turn up, people from, it's in Manchester, but we'd have people from London and Liverpool and Preston and further afield, and you know, and they would come because what we were doing is engaging practitioners and policymakers, as well as people who use services in the wider community in these conversations. And I think if I'm very honest, I am a little bit ambivalent about the whole notion of cultural adaptation. So I think it's very important to treat people as individuals who exist within a social context and to have a good understanding of what that is. And that practitioners have the tools to be able to do what is truly person-centered care by being able to do, you know, kind of individualized formulations. The problem we have is at the moment, practitioners, most of them, if they're going to have any kind of real competence in this area, despite the banding of the phrase cultural competence, for those people who are going to have any real skills in this area, it's mostly they're going to be doing it themselves, post-qualification as CPD. It's not integral to people's training. It's not integral to the way they think. Certainly thinking about psychology, you know, we still have a predominance of white, classes changing a little bit, but white women predominantly. So, and that's not to say that white women can't have any insight and understanding of what's called, I'm going to call it euphemistically, the Black experience. I know there's no such thing because we're not all homogenous, but you're not going to get that by accident. It's somewhere you're going to have to have learned it, either through your experience, because you're part of a community, or you're in your extended family, or some other thing, or through your training. And in that training, I think people should be being exposed to the notions of their own ethnicity. So it's really interesting to me how it's only Black and brown people who have ethnicity. Well, it's not. We've all got an ethnic origin. I've got friends who are Welsh, and they're Welsh. They are not, you know, they will use a British label, but you won't be tired if you call them English, because they're not. They're Welsh. So, you know, even within the UK, the UK's white majority population, some people own their ethnicity, but generally speaking, ethnics are the kind of, you know, the black and brown people. And so I do think changing the therapy is, for me, it's very much a vehicle for having a bigger conversation about what really needs to change. And so when service users are talking to us, you know, when we're doing that work with the cultural adaptation, the pilot study, what they said was, actually, the therapy as it is, yes, there's some tweaks that we need to make to it. You know, we need to talk more openly. We need to actually mention racism and actually put that in there as people around people's experience. So we talk about people's service users assessment. We need to actually ask people about racism. We need to talk about faith, and there are a range of other things. But they're actually relatively small. What they've said is what really needs to change is the therapist. It's the therapist that matter. You can have the most amazing therapy on paper, but if you don't have therapists who are competent to deliver it, and to deliver it in a way that doesn't pathologize my beliefs because they're not the same as the therapist, doesn't pathologize my family because my family structures are different from theirs, unless you have those kind of people in that delivering that therapy, it's not going to actually have the impact that you intended. And I absolutely agree with what Stephanie said earlier on. This is one of the reasons why I am so passionate about changing the system, because I feel, especially now, we're engaging people in doing this work around cultural adaptation, and the idea behind it is that you have something that when people do come into services, that they do have a therapy that they can actually engage in, and that will actually help them. But the services have to be different, because I think it would be unethical of me to encourage people to go into services which I know is going to abuse them, which I know is going to pathologize them, which I know is actually going to leave them feeling more damaged than before they engage with it. So, and I think from a pragmatic point of view, the UK, particularly in our urban conurbations, have very diverse populations. And so are we going to have a culturally adapted family intervention for African diaspora people, African and Caribbean diaspora people? We're going to have another one for South Asia. We're going to have another one for East Asian. We're going to have, and one of the things that is really important, so even when we're doing the stuff with Caribbean origin people, is training up the therapists and saying to them, there is no such thing as Caribbean culture. The Caribbean is made up of lots of islands, and we've all got very different experiences. So we have to be careful that with this cultural adaptation, we don't reinforce the homogenization of people, but we actually enable therapists to work with people and ask them to define their culture, ask them about what is important to them. So that's really at the heart of it for me, is the work that we need to do with the professional bodies to push them to say, we live in a diverse society. We should not be training professionals to go into health and care and health and social care sector who don't have this as basic understanding, so that when they go out into the world and they're working with service users from a range of different backgrounds, they're ill-equipped, and some of them unfortunately don't know that they're ill-equipped. So some of the harm that is done is not intentional, but is nonetheless harmful because people don't understand themselves sometimes, and they certainly don't understand the clients that they're working with. And if you think about certainly the work that I'm doing at the moment, where we have a preponderance of white female psychologists, and you've got services where there's a predominance of black men, and you think, well, how are those therapists being equipped to think about, well, when you go into a room, what do you bring, and how do you work that out, and how do you actually have the conversation about the elephant in the room, which is racism and discrimination?
Thank you very much, Dawn. And I actually really want to develop on some of your concluding points, but later on in the event, particularly around your statement that culturally adaptive processes should not homogenize Black people or anyone from an ethnic minority backgrounds experiences. It really needs to take more of an individualized approach that caters towards their specific cultural needs. And I really appreciate your point about the need for not only just diverse practitioners, but also practitioners who are culturally competent and sensitive and know exactly how to address the needs of their client. Very quickly.
Kish, just before you move on, I was just going to say, and that's so important to highlight the point, that that's not just about white people needing to have cultural competence training. So if we are taking Black people into psychology, psychiatry, any of the professions, and we're training them in a, what's for want of a better phrase, a Western model of thinking about mental health conditions, and there isn't any space for them to explore their own thinking and bring their own culture and their own bear into those kind of conversations, and all you do is have Black people delivering the same kind of therapy, which for some service users and their families is actually more damaging, because in a way they don't expect anything different if it's a white therapist. But when you see someone who looks like you and you expect that they're going to have a better empathy with your lived experience, and that doesn't happen, that can actually be incredibly damaging.
No, definitely. And actually, just quickly before we move on, I wondered if I can get a quick answer from you, Dawn, if you can make it just 1 or 2 minutes. What would you actually recommend to healthcare services or practitioners to enable culturally adaptive psychosocial interventions for service users, or just looking at models for cultural competency and training towards these individuals?
So I think what I was trying to say, and maybe not very well, is that if we train people well enough, and if we make sure that not just the undergraduate or pre-qualification, but post-qualification training is good enough, and if we have robust systems of monitoring and evaluation, then I'm not sure that we would need culturally adapted interventions. What we would have is a system in which whoever you are, whatever your background, whether it's in terms of your diversity, whether it's in terms of ethnicity or sexual orientation or levels of ability or whatever, that people who are working with you will be able to work with that range of diversity and difference. But because we don't have that kind of built into the system, and there isn't any way at the moment of meaningfully monitoring and evaluating that in terms of people's experiences, services and commissioners don't have a framework to kind of use that as part of their commissioning tool to say to services, you know, when the services we're buying from you, we expect X in terms of cultural competence. So the cultural competence thing is a bit vague. So people use it as a phrase, but we don't have any like key performance indicators. What does that actually look like? What does it mean? So I think there's a lot of work to be done, and we just need to get beyond the glib phrases and actually do the work.
Thank you very much for clarifying and highlighting that. So I'm going to move on because I really want us to get towards the unstructured Q&A session. I see loads of questions coming in via our chat. I'm going to move on to public engagement and appointments and leadership as kind of part of this event. And I'm going to address what we've been talking about quite a lot from now, is about equality, diversity and inclusion. So the public sector equality duty requires public bodies to have a due regard to the need to eliminate discrimination, advance equality of opportunity and foster good relations between different people when carrying out their activities. Hence, higher education institutions have developed equality, diversity and inclusion groups and appoint leads, such as yourselves, which ensure that inclusive, diverse and supportive environments are created for all students and staff. However, a leading Routes report revealed that inequalities and bias within higher education are substantially disadvantaging Black students and impacting their access to the funding required to support their further education. Discerningly, it found that over a 3-year period, just 1.2% of the 19,868 studentships awarded by all UKR research councils went to Black or Black mixed students, with only 30 of those being from a Black Caribbean background. This, coupled with the lack of representation we see from Black ethnic groups in postgraduate programs and research, undoubtedly raises questions about the effectiveness of some of these initiatives within higher education. So the question I pose to both of you is, from your experience, what does true equality, diversity, inclusion look like in academia for both students and staff? And I think I'll start with Stephani.
Oh, well, it doesn't look like it looks right now. That's for sure. I think you have to take those things. For me, it's about separating them out, because if we just, there's been a lot of emphasis. I as you mentioned in my introduction, I mean, one of my responses to not seeing people who looked like me when I came to King's, not seeing the representation in terms of research or among the PhD students, was to get involved in the diversity and inclusion work. First centrally within King's and very much focused on race equality, and then later more broadly across a wider sort of cultural diversity and inclusion work, leading the faculty with my colleague Anne McNeil. Something's got to give, and what would it look like? It would not look like, I guess I could more say what it won't look like, and it will be the point at which I don't teach every year and get students coming up to me saying, I've never had a Black lecturer before, which has happened throughout my entire career. I was really, I had an interesting conversation with one of my PhD students who said that she was one of those Black students on the master's course who came up to me and made that comment. And, she's just completed her upgrade successfully in her PhD. And so that's what success looks like. And to see that working with undergrads. So I've mentored undergraduates, and seeing that inclusion piece is the most important to me. And that's got to be, again, it has to be deliberate. The inclusion piece is that's the practice. That's because right now we're still in a situation where racial equity is, you're not seeing that in terms of, what's happening with students, what's happening with the staff more broadly in academia, and then what's happening with academics. So there's a lot of still work to be done. And I think we're making great strides towards that. But, it does sometimes feel like 5 steps forward and 3 or 4 steps back. But as I say to people, this is, for me, I think particularly because I grew up in an environment around civil rights, that this is not a sprint, that this is something that is going to take a lot of concerted effort on the part of everyone. As we say, equality, diversity, inclusion is everyone's business. And it has to be both from the ground up in terms of a grassroots movement within academia, but also needs that senior leadership to invest in it. And it's got to be embedded across every part of the university. So, we're definitely seeing some movement, and certainly in the past 3 years, particularly around race equality, seeing movement in the right direction. But we're just getting started. And I need, I've said publicly, particularly with regards to the increase in discussions over the last 6 or 7 months, and the increase in commitment and in actions towards race equality, that we need to see this continue for me to believe that there is that level of commitment. I'm sure there are a lot of my colleagues, white and non-white, who want this to go away because it does make them uncomfortable. But it is an uncomfortable history. But it's our history. It's, the embeddedness of racism in institutions like higher education, attending to, fixing the problems is going to require a lot more than training and some group conversation. So for me, it's really about how do we look at the system and identify those barriers and go after those barriers, because it's not always the obvious things that are creating those barriers. Sometimes it's very much, the piece that, you wouldn't see if you don't sit and analyze what would have happened differently in that situation if that person had been white, for example, right? So it's about really taking a close scrutiny of the policies within academia, affecting students and staff, and trying to address those one by one and backing them up with policy, solid policy that has that buy-in from the senior level, but also the commitment on the ground of the people that it affects.
Thank you very much, Stephanie. And Dawn, would you like to also comment as well?
This is a challenging one, isn't it? And I think one of the things that I think we need to do is, I think like Stephanie, I could probably more easily say what things wouldn't look like than what they would, but most definitely in order to get there, one of the things that we absolutely have to do is to focus on the sociology of the leaky pipeline, I think I'm going to call it. So why is it that that people are falling out of the system? They come in as bright, able, willing students, and somehow they're leaving. We're taking bright students, and we apparently are turning Black students into less bright people. So they come to university with good A levels, and yet by the time they leave, they're doing less well than their white counterparts and Asian peers. And I think this is where some of this structural and inherent racism and the unconscious bias is within all of us and within the system, so that for a long time people have known this, but we kind of go, yeah, well, it's almost as though, well, maybe it's just because they're Black, maybe they're coming and their qualifications aren't as good as white students. And even though people have done that work, when they've shown that even when you allow for entry grades and you compare like with like, Black students are still doing less well. They're more, and certainly UK minority students are more likely to be disciplined, to be, all kinds of things that happen along that pipeline. I do think, like Stephanie, I have lost count of the number of times people, usually women actually, have said, you are the first, and they usually say you're the first Black woman academic I have ever met. And I've lost count of the number of times that is. And that can't be right in 2020. So, but I think there's some stuff that we need to do further upstream. A lot of, certainly thinking about my own family, and the way people talk about going to university, was you're going to university to get a better job, and there was no real understanding about academia as a career path. I certainly didn't have that. I kind of stumbled into it by accident. So there is something about careers in schools, which in my experience was really poor, and from what I gather from some people is not that much better, and particularly the way they limit the options that are available to Black students in particular, and kind of push them towards not A levels, but vocational, not Russell Group, but all of these things that tell them that they're not quite good enough to go to places like Russell Group University, let alone the Golden Triangle. So yeah, it's and I think my experience both in the NHS and I think in lots of other public sector organisations is, although we have the Equality Act and this public sector equality to duty, it's because it doesn't seem to have any teeth. I don't know anybody who's been prosecuted for not delivering on their public sector equality duty. I'm sure, I don't know, I'm not saying that there haven't been, but the fact that you can have this level of inequality, and you can see it in these organisations, from recruitment through retention, through the awarding gap, through salaries gap. So we can see all of that, and yet nothing's done about it, even though we've got legislation that says that this is illegal, this shouldn't be happening. So yeah, it requires a change, massive structural changes, and people. And it definitely is not something that Black, Asian and other UK minorities can do themselves. This is stuff that has to happen collectively, and definitely those people, as Stephanie's talking about, as the senior leaders need to own it. We need to see the commitment.
Thank you, Dawn, as well, for particularly highlighting the leaky pipeline and also identifying that this is a structural issue that really needs to be addressed within the higher levels of these institutions. I'm going to move on because we have about 10 minutes left of our kind of structured Q&A before we take questions from our attendees. But I really want to highlight, in regards to this next topic, about inspiring the next generation. And it kind of goes back to the idea or the discussion topic that there are multiple barriers that affect Black people when they are trying to access and navigate academic careers. And as such, breaking this glass ceiling can often feel too difficult and not worth the time and resources needed for it to be shattered as a Black person. So my question to you both would be, why should Black people aspire to academic careers in the mental health field? And what advice would you give to the students or early career mental health researchers or professionals who might aspire to becoming a professor? Stephanie, did you want to go first?
So to answer the question about why you should, why shouldn't you? You know what I mean? There's a desperate need for us to be at the table, for us to be a part of the decision making about, the way our communities are treated, the policies that affect us, but the broader public mental health policies, how services are delivered, the quality and the content of those services, and what they're delivering. We need to be at that table in order to make change. Because others aren't going to do this work for us. It hasn't been done, and it's not likely to happen. So I would just encourage, our voice needs to be heard. The best thing about the work that I do is when there's a diversity of voices, and that to me, I bring something to the table. I am very confident about that my white colleagues do not bring to the table. I don't want to be at the table alone, and one of the benefits of being able to build up a group and to have a group of students, I have a very racially and ethnically diverse group of researchers and students around me. And the quality of our interactions is down to the diversity that we bring in terms of our experiences and where we're coming from. I think in terms of advice that I would give, I've got a bit of a list, and it starts with finding your voice. And that's not an easy one. You got to let people know who you are and who you want to be. And it's also your prerogative to change your mind. The second thing I'll say is that you've got to know what's expected of you. I think when I think back over the journey to becoming a professor, it's important that I had that communication with my supervisors, with my line managers, know how things are progressing, what I'm being, benchmarked against. And then, of course, there have been many, many times where I felt like I had to do even more. But it still is really important that I know what was expected of me. It's going to be uncomfortable, but you have to get comfortable with being uncomfortable, having difficult conversations. Get outside your comfort zone and really sort of press people. I think that's part of finding your voice, speaking openly, as I said early on, making sure that you speak openly with your supervisors and your line managers about race. The next thing I say, and this is an important one, let other people say no. Right. My dad used to say that to me all the time. Nobody likes to be rejected. No one likes rejection, full stop. But you can't let yourself be the biggest barrier. And part of that is just to keep moving forward no matter what. I've talked a lot about mentors. You have to really find somebody that is your champion. This is not someone who has a vested interest in what you achieve. This is someone who can look at a situation and help you develop a strategy. So really make sure that your mentor is fit for purpose. You may need more than one. So over time, I have had at any one time, 2 or 3, because they serve different purposes. And the other thing is I would say is just be empowered, empower yourself, because if they're not serving your vision, then and your aspirations, then you may need to break up with them. So you have to really think this through. These people are there to help you and to serve you. But mentorship, having the right mentor can be incredibly powerful in helping you achieve what you need to achieve. And I'll leave it there.
Thank you. Some empowering advice, Stephanie. Dawn, same question goes to you. Why should Black people aspire to academic careers in the mental health field? And also, what advice would you give to students or early career mental health professionals or researchers who might aspire to be a professor?
So I think aspire to be academics, full stop. And if it's going to be in the mental health field, that's great. And the reason I say that, and I'm not being glib, is about the transferable skills that you acquire during the start of your academic journey and throughout the whole course of it, are really important. And I think, again, maybe in some in UK minority communities, we haven't yet got sufficient of a critical mass to understand that you go to university and it's not always about arriving, leaving to get a job, and that you can go and do a degree in X and have a completely different career. So, I teach on the undergraduate psychology program, and many of my academic advisees or personal tutees have no desire to be psychologists of any kind. They want to go into HR or into journalism, or they're not sure yet, but they're doing an undergraduate degree in psychology because it's a broad brush. It gives you a lot of skills that are really attractive to a range of different employers. And I think maybe some of that, is what we need to, those of us who are within the academy in various ways, we need to be sharing that knowledge back with our communities, because people don't necessarily know. I think once you are, and I think particularly with mental health, we know that in the general population, is that 1 in 4 people at some point in their lives are going to have some kind of mental health difficulty. So we need people, if it's you or a member of your family, wouldn't it be great if you had someone like you, someone who was really committed to making a difference, to really trying to understand, to changing the system. So, a bit like I said about me, why not me? Might as well be me and somebody else. And I think one of the things that Stephanie said, which was really powerful, was about knowing the rules of engagement. And I'm still learning them, but it took me a long time. And I think that was the value of my wilderness years. It's kind of going around thinking, what, how does that happen? And I don't understand that. And realizing that, I say to people, it's easier to laugh about it now, but it's over. But say to people, I felt like sometimes I turn up to play a game of football and everybody else was wearing tennis whites or, cricketing gear. It's like there was a different game. I didn't understand what the rules were. And even when I read things like promotion criteria, it always felt like there was something kind of hidden. So there was what was on the paper, and there was this other stuff that some of us don't know, don't understand. And those are the kind of conversations that it's difficult to have because you don't know that you need to have them. And even when you know that you need to have them, not everybody's open to even acknowledging that actually exists, that there is this soft knowledge or this soft stuff that goes around these apparently, objective criteria that if you don't actually understand, it can stymie you. Asking, I think, as Stephanie said, having really good mentors, but even if those people are not available, understanding that you have rights as an employee, and to really know that you've got to be your own champion. You have got to be your own champion. We know that sponsorship exists. With the old boy network, the old boys network is a real thing, and it's increasing an old girls network. And because there's not a critical mass of us, there are not necessarily these people within institutions to open doors for us. So we have to kind of knock at the door, and we have to keep on knocking, and we have to be even if we're not, but that confident, we have to grow in confidence, and we certainly have to know what our rights are, and to be able to go to line managers and academic advisors and tutors and say, this is not working, what can I do, what should I be doing differently, and having those sometimes very difficult conversations to be on the receiving end of for both parties, I guess. But that's the way, you know, to kind of get through it. And I am absolutely committed to sharing, you know, which is why I'm quite candid about my wilderness years. I'm very candid about them because I'm committed to wanting to share that with people, because I think it's really easy to see people who are where Stephani is or where I'm at and other people and assume that we've had, you know, this incredible journey with lots of people being helpful and supportive, and or that we're somehow super special. And that's not the case. You know, there are some people who are very fortunate that they have excellent mentors and people around them, but for some of us, no. And that, you know, and that means that we then have to find some stuff from within, you know, if it's not going to be there. But and then, you know, the big thing I would say is that you're never too young to be a mentor yourself. So don't wait until you're a professor or a senior lecturer or a lecturer before you start mentoring others. As a postgraduate, you can be reaching back to undergrads and back to people in the sixth form or younger in schools. Wherever you are in the journey, you have something that you can give. And certainly when I support people in whatever way, I just say to them, you know, the only thing I ask of you is that you pay it forward. You do this for somebody else.
Wow,
yeah.
Thank you very much, Dawn and Stephani. And that actually concludes my Q&A session with myself and you guys as the chair. I hope my team can unmute their mics to give you a whole little virtual clap.